All right, welcome. As noted, these slides will be available and this event is being recorded. Take a look in your inbox this afternoon for the materials. Okay, so our agenda here. We will just spend the first 15 minutes. I'm going to go through the rules and regulations for you to understand where things are at now and the status on this from a public policy perspective in Wisconsin. Cliff Notes version is it's almost here. It's kind of in the last phases. The bill was passed and now we're looking at actual implementation. And then most of the time we are so welcome or happy to welcome colleagues from Southside Community Health Services and FQHC based in Minnesota that will share a presentation and then be here for all of your operational questions and discussion. And then we'll wrap up by 2:30. Our webinar objectives are here, understanding what this looks like in a health center setting and figuring out how the lessons learned by Janelle and Dr. Quinlan can translate in your own environment. Know where to find resources about dental therapy specifically for Wisconsin. And then identify any action steps that if you are, or if your practice is really interested in incorporating dental therapists, how might you want to get ready or think about those next steps? So just as a disclaimer here too, this is a health center specific webinar. So we can talk about reimbursement, we can talk about PPS or other questions you may have there. We've also invited a few kind of friends of the family to join us too, but we are among health center world here today. So I'm just going to go ahead and dive right on in here. All of this with the note that I am not a dental professional. I am your public policy voice in the Capitol and with policymakers. But if it's weedsy issues, I will be very, very happy to turn it over to the experts, not only at Southside, but there's a lot of other folks on this call here who have a wealth of experience related to dental therapy and oral health practice. So this is my favorite resource I just want to start with. This was developed by the Wisconsin Oral Health Coalition, and thank you to folks joining from the coalition today too. It is just a great chart that summarizes what the various dental professionals authorized to practice in Wisconsin are here. And there's 2 pages to it. There's another that shows the training and practice scope provisions. This is a wonderful resource if you're just looking for a quick sheet, or if someone in your health center, maybe a CFO, is asking, what the heck are these folks? How do they fit into the rest of our dental team? I think that this is a phenomenal resource that is linked in the slides, which you will have access to after the webinar today. So what has happened with dental therapy so far? In the last day of January this year, a bunch of dental therapy advocates all joined Governor Evers as he signed Act 87, which is Wisconsin's dental therapy law. This was after 6, 7, 8, 9 years of working on this bill and a lot of negotiation behind the scenes, and eventually bringing it to fruition across that finish line, which is so exciting. And thank you to everyone who is on the webinar here who has had a role in advocating for the enactment of dental therapy. And I'm just going to go ahead and mute folks, and if anyone I hear has background noise. And as a note, Wisconsin is one of the only states in the Midwest that has dental therapists authorized to practice here. Of course, Minnesota does also, but we're kind of at the cutting edge here. So learning a lot, and it's a very well-known provider type in a lot of other countries, but not so much here. So we're just building that base of knowledge in Wisconsin these days. And on this slide in particular, I'll point you to these 2 links. This one is a summary from the very smart lawyers who work for lawmakers about the law itself, but this is the full one. So the actual language, everything I'm going to share today comes directly from the law that was enacted. That may look a little tricky if you're not an attorney, and I certainly am not one and do not play one on TV, but to find the relevant information, you're going to look at this link right here. So first of all, and as I noted, I'm not going to go through all of the text on these slides. I just want you to know where it lives and then kind of provide that baseline. So the legislation does provide the scope of practice for dental therapists. And as noted, which we'll discuss a little bit later too, That scope is subject to the terms of a collaborative management agreement or a CMA. So every dental therapist needs to enter into a collaborative management agreement with a qualifying dentist. And that agreement, this is basically the ceiling of what everything a dental therapist can do. That agreement could constrain that a little bit or keep it just like this or say only under these conditions or circumstances, whatever it is. But this is the relatively broad scope that dental therapists can practice under here in Wisconsin. This is list item 1 through 14. So don't freak out. There's also the rest of these items here, noting non-surgical extraction, and many other items which are within scope for a dental therapist. It is important to pay attention to schools and accreditation factors if you are an employer, if a health center is considering hiring a dental therapist. This is a little bit different than you may be used to with hiring other particular staff at your organization. But a dental therapist must do one of the following: graduate from an accredited dental therapy education program or something else, which is outlined here. I'll note that there are currently 3 schools that are accredited by CODA for dental therapy. The University of Minnesota is one, Alaska has another, and Washington State has the third. There are many other programs that either are or will be seeking accreditation in the future. And then this outlines the other provisions related to different programs. The important thing here is to note that a dental therapy education program that is located in Wisconsin will also be qualifying under certain conditions here, which are being pursued because North Central Tech, based out of Wausau, intends to launch a dental therapy training program in fall of next year with a first class of 12 students, all of whom, to last I heard, will be dental hygienists coming into the program and then graduate with this dental therapy degree as well. That's still in the works, so there's a lot of folks getting that off the ground, as well as state funding that helped develop that program, which is very exciting. But it does mean that folks need to be thoughtful about looking at the training and credentials for dental therapists who are already practicing and who are trained in another state. I'm just going to talk very, very briefly about supervision. Here are a few of the terms used in the statute related to supervision. There's direct supervision, where the dentist and the dental therapist are right there. There's general supervision, as well as indirect supervision, which all matter based on some other practice requirements and the way this law was written. So the important thing here to note is that a dental therapist, again, must practice under that collaborative management agreement, and then only under the direct supervision or indirect supervision of a dentist under that agreement. And there's a 2,000-hour practice requirement. So bolded here. Once a dental therapist has provided at least 2,000 hours under direct or indirect supervision, the dental therapist may provide services under general supervision still of that dentist under a collaborative management agreement. So that is a way to get everyone comfortable working together, figure out what that looks like, and then really begin that generally supervised practice. We are aware that plenty of folks in Minnesota, if they're practicing already, will already have been in place serving their 2,000 hours of supervision. They would not have to repeat that again in Wisconsin, is my understanding. As long as the dentist that is their qualifying collaborator is okay with that. And again, that would be outlined in the collaborative management agreement. And again, I'm moving very quickly because I want to focus our time mostly with Southside, who are really the experts here, and all of this language will be available for you as a reference, just setting the baseline here today. There are specifics about the collaborative management agreement in Wisconsin state law. That's got to be written and documented. It doesn't need to be submitted to state agencies or kept on file anywhere fancy, but it does outline what should be included in that collaborative management agreement. And then finally, I'll note that a dental therapist could have multiple collaborative management agreements. So for example, if they're working at Scenic Bluff 2 days a week with a dentist there, and perhaps at Family Health Center of Marshfield for 3 days a week, or a private practice, they could be serving under multiple collaborative management agreements. And then a dentist can have up to 4 dental therapists with collaborative management agreements. So that dentist could have them all at, one health center site or across various ones, but no more than 4 at any one time. There was a lot of discussion along the way about where should dental therapists be able to practice in Wisconsin. There's some concern about flooding the market, but this is going to be a slow burn, so I don't think that's something we need to be too concerned about here in Wisconsin, because we all know that the dental care shortages are acute pretty much wherever you go, especially for Medicaid and uninsured and low-income patients. So the language says that a dental therapist can practice in various settings and one or the other of these qualifying factors. So at least one of the following, and not necessarily both. In a dental health shortage area, these are calculated by the primary care office in the state, and honestly, most of Wisconsin is a dental health shortage area. I think maybe 50 of the 72 counties are now. And again, or doesn't have to be both, or in a practice where at least 50% of the total patient base of the dental therapist is made up of these patients. So we are all community health centers, so any dental therapist practicing at a community health center is certainly going to meet these requirements. I did receive a question recently about whether all of this needs to be proved or attested to at the time of licensure or credentialing or renewal. None of the above. This will only come up if a complaint is filed with the Dentistry Examining Board, which has oversight for this profession and other dental professions, at which point someone would need to verify that indeed they are practicing in accordance with these requirements. So if you are wanting to practice in a health center in Wisconsin as a dental therapist, we will be excited to have you. So that's kind of the big components of the law. Of course, there's more. The Dentistry Examining Board concluded their process of rulemaking, which basically always happens after a law is enacted. They have to put all the bells and whistles on, but this law was pretty prescriptive, so they didn't have that many details to work through. My understanding is they have concluded their work. They might, still need to do some permanent rulemaking, but basically what they have promulgated already, which is the fancy word for making rules, will be relatively similar to the permanent thing that they figure out. But essentially, moving forward, the Dentistry Examining Board has concluded their work on this for now. The licensure agency, DSPIS, which I know everyone has some frustrations about how quickly they can turn around licenses, but they already have the system in place. And last I heard, they'd already received 1 application for licensure here in Wisconsin, which is pretty exciting. We are keeping in very close contact with the state health department about the next steps, because they need to figure out enrollment, billing, coding, all of these things that are the next steps in the process. We're not sure what that timeline looks like. We are hopeful that a dental therapist will be able to bill under a dentist's NPI. But all of that is yet to be seen, and we don't quite know exactly the timeline for those provisions, but we want to start thinking about what implementation looks like while that happens. As soon as we know more, you will know more. And then finally, we're really hopeful that there might be some, dental therapists that already qualify under all of our rules to begin practicing in Wisconsin sometime soon. But we don't know yet, so we're not quite sure what that demand is. And the graduates from the North Central Tech program won't be with us for another 3 or so years. But that is the lay of the land where we are at right now. And our primary way to communicate the big updates about dental therapy for health centers will be through our Oral Health Peer Learning Network. So as there is more on the timeline or these other components that we're not sure about yet, we will be communicating with our Oral Health Peer Learning Network. If you're not involved with that or not sure, just let me or another person on the WPHCA team know, and we'll be sure to connect you. So this page has a bunch of resources. This chart is the one that I shared on our very first slide. There's some other information here, and then I will note that the Children's Health Alliance of Wisconsin is developing a resource library, maybe available sometime within the next month. But that's very exciting. It'll be a place for webinars and materials to live, maybe some sort of toolkit things or templates. We will see as all this unfolds. And then finally, these are some resources from other states, as well as some surveys and reports looking at the data related to dental therapy. So you just got a whole bunch of information from me. I will stop talking because I am so excited to welcome Janelle and Dr. Quinlan, both of whom are phenomenal dental therapy advocates who are eager to share their experiences here with us in Wisconsin. And as I noted, if you have questions, I will be monitoring the chat, but I want them to get a lot of information to you, and then we'll go to chat and discussion after that. So welcome so much, Janelle and Dr. Quinlan. We are overjoyed to have you here today.
Thank you.
Thank you.
We are very excited and happy National Health Center Week.
That's right. How can I forget?
That this is the perfect opportunity for us to celebrate and collaborate. Today at Southside, it's Twin Day. So as we do different activities throughout the week, so we decided to bring out a little Wisconsin pride.
Wow.
For as our twin day support and for the opportunity to meet with you all today. So
bonus points to both of you. Thanks for showing the pride. And Janelle, I know you've got a Wisconsin connection too.
Yes.
So
yes.
Thank you.
Thank you. So I will share my screen and we will get started. One moment.
And as I noted, as you're getting ready, we'll share all of these slides for folks afterwards. So don't feel like you need to take screenshots, take notes, anything crazy like that. Looking good, Janelle. Great.
Perfect.
All right.
So thank you for the wonderful introduction. My name is Janelle Yane. I'm an advanced dental therapist. I am the dental clinical director at Southside Community Health Center and the past president of the Minnesota Dental Therapy Association. I graduated from the University of Minnesota School of Dentistry in 2013. So I was one of the first cohorts of the program. And I was interested in dental therapy. I was just brought into a kind of a learning or training session when I was attending a pre-dental meeting, and they invited me to stay and learn more about this exciting, new, innovative profession in the field of dentistry. And that led to applying and acceptance, and that curiosity has brought so many wonderful opportunities and has led me here to working in this environment, working in a community clinic that I love, and really finding that purpose for myself in oral health. And want to thank everyone for their curiosity, for being here today to explore dental therapy and to explore how we together can learn and address some of the needs that we have in our communities. We have Dr. Quinlan.
Right. I'm Dr. Brian Quinlan, and as I say to patients, you may call me any combination of those words. Yes, I am the same guy in the picture, and just changed my appearance over the last few years. We'll see how long that lasts. But I originally hail from Mequon, Wisconsin, went to Homestead High School and Lawrence University in Appleton, Wisconsin. Graduated in 19, and that was a while ago. Let's put it this way. I watched the Packers' second Super Bowl victory. So well acquainted with the state, and happy to be here and talk with you about dental therapy.
Yeah, we have that connection to Wisconsin. We both want to see it successful in Wisconsin, as Dr. Quinlan has really paved the way for dental therapy to be successful in Minnesota. I'm from Wausau, Wisconsin. It's my hometown. So knowing that where I grew up, they're going to be educating and providing a training program for dental therapy. I'm extremely excited and passionate about. So whatever we can do to help support you and make dental therapy successful in Wisconsin, will be here and will be resources for everyone. So our agenda, our loose agenda that we have, we're going to share a little bit about Southside so you can get a little bit of background about our clinic, talk about the why and the what behind dental therapy, and then really focus on how and the integration piece of dental therapy so that you can start thinking about how dental therapy may be, or a dental therapist may be utilized in your clinic. We'll also touch base a little bit about patient messaging and offer some resources that have been helpful for us in Minnesota, different toolkits for supporting a dental therapist in the hiring process. And then, yes, enough time for questions that you may have. So about Southside, the image that you see on the left is the exterior of our current building. Southside has been in the community for over 50 years as a federally qualified health center. In this location, we have vision services, dental services, as well as behavioral health services. And then we have a different location that is our medical clinic and additional behavioral health services. The image on the right, we have exciting news that we are breaking ground to create an additional clinic. This will be on Lake Street in the center of Minneapolis, and it's going to be an opportunity for us all to practice under one roof. So we will have a second dental site, medical, vision, and behavioral health. The ribbon cutting was just announced that we'll be breaking ground September 18th. So really excited for Southside and for us to have an opportunity to provide more services and care for our community. So our clinic, our team, so we currently have 14 operatories. I know it didn't start that way. The clinic 50 years ago, I think, started with 4 operatories, and then we've slowly built onto that. The greatest renovation was adding 2 additional operatories in 2020. And our team dynamic, as far as what we have, or the different team members, is we have a lot of different types of team members and a lot of different types of dental therapists, as you can see. So 4 full-time dentists, 2 part-time. We have 2 full-time advanced dental therapists. So that's, if with going back to how we kind of categorize an advanced dental therapist, is that they've had that 2,000 hours of, at least that 2,000 hours of patient care. And in Minnesota, they do take different tests and certifications that are an interview component, and there's a case review and case study component and a written test as well to have that advanced certification. But the scope of practice, which is that general supervision that was discussed, is what you see with that advanced dental therapist. So we have 2 full-time advanced dental therapists, 1 full-time that is me, an advanced dental therapist and the dental clinical director, and then 1 full-time dental therapist that is dual licensed. So going to be very similar to the program in Wisconsin, an advanced dental therapist and then a dental hygienist, dual licensed. And then we have a part-time provider that is a dental therapist, so yet to receive the advanced certification. So still operating under that indirect or direct supervision, and a dental hygienist. So the why. So they say if you've seen one health center, you've seen one health center. So it's very much that when we think about the why and we start talking about the what, the outcomes that you want to see, and the how we can do it, or how we can implement those or get to implement those strategies to get to those outcomes. It's one of those things where every health center can be different, but I know that general rule, or what we're all kind of set out to do, is that overarching goal of addressing the oral health needs of our specific community and improving the oral health of our community. So I think at Southside, when we've think about that why, and we think why we're set out to do the work that we do, we really focus on through what we want to achieve is innovation, and how we're going to do that are these innovation approaches and strategies. At Southside, we have Oceans, electronic health record. That has been a huge way for us to collaborate with our medical team members and other health centers or other healthcare facilities, and focusing on the patient as a whole. We use Blue Note messaging system. It's been a great way for us to communicate the needs of the team. We really focus on schedule optimization, which I'm really excited to talk about today, and show some specific examples from our schedule of how we've been able to incorporate and really optimize clinical needs with our different approaches to care. We know that cost to care influences or has a large impact on treatment planning decisions. So we've taken a lot of those cost conversations outside of the operatory and have added treatment plan coordinators to have further discussions and to work for different solutions for making the cost to care affordable and taking those conversations out of the operatory so we can focus on providing the care. We've also, when we focused on innovation and listening to the needs of our community, there's a huge need for walk-in or urgent care services where patients are at, meeting patients where they're at. And then we are the first clinic in the state of Minnesota to graduate the dental assistant apprentice program with the partnership of Minnesota Association of Community Health Centers, so that we are training with partnership with them dental assistants. So we're now on our third cohort. We were the first health center to be able to do that. So again, it's constantly thinking about innovation, and a huge part of that is also dental therapy and thinking about how we can continue to be innovative. I wanted to just share a story a little bit, and then wanted to pass it off to Dr. Quinlan as far as, Dr. Quinlan and I have worked together for a very, very long time, actually at a previous health center. And when I still remember going into his office, sitting down, and him explaining the why so clearly. I have a resource here. This is the National Network of Oral Health Access, their operational manual, that he pulled that out. I think it was page 21 at that point. I think now I just looked at it. It's like page 21, 22 maybe. But that it talked about the phases of care and the required services, and how the scope of services that as a health center that we are required to do and that we should be focusing on, that have been proven to really improve the health of the community, are the services that the dental therapist provides. So he, as one of the first dentists to hire a dental therapist in a community health center setting 10 years ago now, it was a really great way that he continued to communicate that why to me, as far as, this is why you're here, this is why we need you, is because your scope of practice is in alignment with what we're doing here. And I know when he came to Southside, he had that same exact approach. That Southside, before Dr. Quinlan came here 7 years ago, said, we need dental therapists here. So I wanted to then ask Dr. Quinlan if he could, a question, and see if he could share with the group as far as just why, talking a little bit about the why, as far as what went into his mindset about why he wanted to hire a dental therapist.
All right, thank you.
Yeah. Mm-hmm.
So my first exposure to dental therapy was actually a newspaper article that I just happened to come across and read with some interest. Might have been when I first started at an FQHC. And seeing that and seeing where I was at the time, that I knew that there was a need for such a position, and it didn't really intimidate me based on what I read in the article. Unfortunately, it was very unpopular politically within the dental community. So the first few times in Minnesota, it was struck down. But anyway, getting back to the why, it was hard to attract and retain dentists in the previous practice that I was at. And I knew we had to do something. I had to get somebody in there. The executive director at the time had not heard of it, so my first job, I think, was selling her on it and letting her know what it was all about. And I did a good enough job because she was behind it. At that time, also, we had great support from the University of Minnesota, and I knew what was going to go into the program, and I knew what the graduates were going to be like. So I was satisfied that we would have quality people. And I also went to the other program that was in existence at that time, which was at Metro State. And I won't go into that story, but I visited them as well, and was also impressed with the quality of their program. So I did my due diligence on what they would be like, what they were able to do. And I knew that we were in a situation that they would fit in perfectly. And again, I wasn't worried about any political repercussions because I knew what they were about. They were for areas where there's 50% Medicaid patients. And I won't go over all that again, but it's very similar to what Wisconsin has. And I knew that it would fit in. And my thought was too, well, if I can't attract dentists to do this, I got to attract somebody to do it. Also, the other thing going through my mind, and don't misunderstand me, is that dental therapists can do pretty much the full range of services for children. And Minnesota at the time was under some heat from the federal government because they were not servicing enough children. And I knew I wasn't going to solve the problem, but I knew I could at least get some people in there that were trained to do mostly that, or had a very sufficient and thorough training with that. And when I had started at that clinic, and also when I had started at this clinic, there were very few children being seen. And in fact, at this clinic, they were all being referred out. And just a brief note on that, referring them out sent them into no man's land because they couldn't afford going to a private practice, and there was basically nobody in Minnesota in private practice that or no pediatric dentists that took the Medicaid plans. So unfortunately, those children really weren't getting much help. So for both places, I needed dental therapists to help get the engine going on getting children into the practice.
So as we focused on kind of outcomes, or what we wanted dental therapists to have an impact on, we were able to find that dental therapists had an increase in our treatment plan completion rates, that our pediatric population, we were able to increase the amount of children we were seeing. As far as our access rates and our no-show rates, that we were able to increase our access and decrease our no-show rate,
right,
which was helpful. And then also our quality measures that we have, specifically dental sealants, really focusing on prevention of caries, and being able to have providers that really focus on not only that restorative element, but that prevention element, helped increase teamwork, collaboration, and communication. Knowing that we have this team approach to care of multiple providers doing different roles in the dental setting you have to work together. You need to collaborate to ensure that care is delivered effectively with for the patient. Financial benefits that we've seen, just that, on average, that you are paying a dental therapist less than you would a dentist to do similar work. Working smarter, not harder, that Dr. Quinlan had kind of said it, that we just found that it's fitting. It fits with our mission and our why and what we're trying to accomplish. And it has been working for, for Southside and for other health centers in Minnesota. And we found that we've had provider and patient satisfaction from having dental therapists as part of our dental team. And now, of course, all of these things, it does take our entire team that have contributed to these outcomes, but that we really have seen dental therapists have a huge impact. And I know that I want to take a moment too to have Dr. Quinlan share some satisfaction of being able to collaborate and working with a dental therapist, what that's like too.
Yeah. Well, in giving a presentation with another dental therapist, she put up a slide that said they are not the therapists for the dentists. And I would beg to differ with that, in an indirect way, of course. But they have been very helpful in the clinic for, first of all, the quality of care that they bring, which is the same as any dentist would bring. They are trained right with the dentists. The model that the University of Minnesota has had, and the model at the other school, is that they had to do the same level of care in both clinical and in licensing exams. And then it has also been very helpful in just the attitude that they brought to the clinic as well. They have been people that have not only answered the questions properly at interviews, which you would expect. Okay, so why did you want to become a dental therapist? Well, because I had experience in a dental office and I felt bad for the kids that we didn't take their insurance, so I wanted to help them. I expected that answer from just about anybody, but when I saw them actually working and actually living up to that answer, I was quite impressed. And I was quite impressed with the professionalism that they've had. They were well-hated people when they first started here in Minnesota, and yet they all kept their cool and kept to what they had to do and just did it and just kept making things happen. And they pretty much ignored the smear campaigns and just did what they could to promote dental therapy and promote what they could do with dental therapy. So in that sense, they've been great. And then something we'll probably touch on a little later, I think, is how they've allowed me to do many other things. And the reason I say touch on later is just because as I was thinking about what I had to say, all of a sudden tons of ideas came to my head. And I hope they still do when I'm talking. But it's sort of like an upside down pyramid. Is once they started, all of a sudden I could just start doing more and more and more and more, and in many different ways. And I hope I can share some good examples with you when time comes.
So now on to the integration piece. So we'll touch base. The next few slides are going to be talking a little bit about change, navigating change, optimization, that will look at some different approaches to scheduling and incorporating dental therapists into the schedule. We'll talk about teamwork and then our patient-centered team approach to care. So as always, change and in dentistry in the healthcare setting can be difficult. So I put this resource down. This is a Simon Sinek book that I found was helpful in my journey through leadership and through decisions that we're having to make at a very high level, as far as leading with the why and making sure that the team is aware of the why, and that you're leading with the why in any change, and incorporating a dental therapist change into your organization. And then sharing the outcomes, sharing what you hope to expect, or the results that you hope to achieve with hiring a dental therapist, and really leaving the how, as far as the process or how we go about it, up to the people that are doing the work. And I think that that's something that has been really helpful for me, knowing that a lot of the best ideas that we've received in regards to innovation have come from the team members doing the work. So integration into the schedule. So we're used to seeing kind of this small team approach for, I would say that's probably very traditional practice for a DDS to work 1 or 2, maybe 3 columns of treatment, and with dental assistants, and having 1 or multiple dental assistants depending on the treatment columns. And then they will have additional either dental hygiene exams, or an RDA column that's maybe doing some work with child prophies or things like that, depending on how your clinical structure is. But that is kind of that traditional small team group, where you have the dentist and dental assistants setting up the rooms, the dentist floating in between rooms, and then having the that kind of assigned, that I'm assigned to these hygienists for the day. We utilize that approach for quite some time, I would say, with even at Southside, that we then viewed the dental therapist as the leader of the team, so that we would have both small teams operating throughout the clinic, that they would have a dentist, a hygienist, and assistants. And that is kind of what you would, if your hygienist had all of their patients show up that day, you were responsible for all the exams. If they didn't, then you didn't do those exams. But it was really focused on kind of that small team, and with dental therapists then being the leader of the team. And it took some strategic scheduling, because we would want to make sure that the day that they were assigned to that hygienist, that was a day where, okay, we can only schedule the periodic exam, the limited exam, or that first exam code with with that team member. So I would say that it works. And again, finding what schedule is going to work for you and for your practice, depending on how many chairs you have, depending on your team, that can be an option as well, and something that we've utilized for a very long time. As far as innovative thinking, and again, this is an idea that came from the dental team, utilizing the people that that do the work to create the ideas, is that we thought, can we, instead of having these small teams, can we look at the schedule as an entire team, and really looking at, okay, how many doctors do we have working today? How many therapists do we have working today? And can we do some daily specific linking of exams and strategic scheduling to really completely, fully optimize every team member that we have and what they're doing? We can see the next slide that I'm going to show. It's a very obvious transition in what we've been able to do, and our access numbers, and how we've been able to see and support more members of our community by changing this approach from small teams, which again can work and has worked, to really looking at the entire team, that it has helped us move towards providing more access to care. So this is the chart that I'm really, really excited to share. This gives a kind of a history of when when we've been practicing at Southside, as far as kind of that standard traditional model of what we've been able to do in a small team compared to, and I think it was May of 2023 when we made this change, and to kind of have this entire team scheduling approach of utilizing every provider, utilizing the dental therapists, utilizing the doctors to the top of their scope, that we really saw that, that evident change in our numbers of what we've been able to do for access.
And I'll just briefly add, though, obviously those are all post-COVID numbers. I helped with some presentations pre-COVID, and at those times it was very similar as well. That with the dental therapists, I didn't have to do as many exams, and therefore I literally ran out of 2 rooms, but that was what I was doing back then, and that made it so people who really needed the care I was able to provide, we could get them in sooner and easier. And that helped tremendously, both with my productivity and with patient satisfaction, because patients who really needed the care that I was able to provide were definitely helped by that. And those same graphs showed at that time that the dental therapists had the highest number of exams at that time as well, because they were just getting up and saying, well, this is an exam I can do, and just going and doing them if they weren't busy.
This is a snapshot of today's schedule, actually. So wanted to share this as far as to get an idea of that. We have Dr. Quinlan, we have our walk-in column that kind of serves as a float here. We have Dr. Quinlan, who's able to practice at the top of his scope with doing a lot of extractions, surgical extractions. And then we have our designated emergency walk-in provider that we have scheduled limited exams, and we're able to meet patients where they're at with emergency care. And then we have 3 of our dental therapists here. So we have then their schedules where we have a designated provider just focusing on nitrous, obviously seeing, more children, their exam schedule or their schedule catered to more children. And then having our other dental therapists really focus on, again, those child exams, those periodic exams, as well as getting that phase 1 care done of controlling the caries, controlling the disease, and really seeing a lot of filling. So this was a really, really cool way to just show how our dentists are working to the top of their scope by doing limited exams and same-day treatment and alleviating pain for our population, doing difficult surgical extraction procedures where we have our dental therapists focusing on nitrous, seeing children, doing the fillings, and knowing that these patients may have been handed off from another team member with kind of this team approach to care. I know Dr. Quinlan wanted to share as far as, even you can see here that there's this limited exam that was scheduled here.
So yeah,
and share this interaction.
Yeah, if you look under Jenny Myers, that middle limited that the cursor is on, that is gray now. That was originally what the doctor who called in today. The yellow under Jenny's name shows that the patient did not show up. And just to see if you're all awake, Janelle picked out the colors. Green means that they're here, and yellow means they're not. If you know what green and yellow is, yeah, it's active colors. So if you're all still paying attention, hope you caught that. So anyway, so Jenny just took it. She's not busy, so she helped out and did that limited exam because the doctor who called in, her assistant is here, so obviously she sat the patient and did all the rooming protocol. And then Jenny came to me and said, hey, I can numb the patient up. Can you take this tooth out? It was tooth number 3. And I said, sure, I can do that. I was already busy with my first extraction patient. So that worked out perfectly. before I went in to do the extraction, with what is now the Gray Limited, I went to Jenny and said, okay, so when my second patient shows up, if I'm still working, can you do the anesthetic? And even though her patient showed up, she just went in there right away and did the anesthetic for my patient, and then went to her patient who was still being roomed anyway. So a little bit of hopping back and forth, but that's what really helped with having a dental therapist, is just being able to do that. Even though we are short one dentist today, that was really very beneficial for us.
Yeah.
Um,
Yeah, I think one thing too to just touch base on is that I'm sure it was a very quick exchange. Dr. Quinlan, I have an extraction for you. And that without a blink of an eye, Jenny and Dr. Quinlan have, obviously the dental therapist, you want to have that close working relationship where you can look at the x-ray, you can look at the patient's history, and that you kind of evaluate that case knowing what Dr. Quinlan is capable of doing and the treatment, that this would be a good case for you. And that numbing, that she knows what Dr. Quinlan would like as far as the carpule here, IAN, long buckle, that she just knows how he would like it completed. And obviously that takes time, that, before it may have been, let's sit down, let's review the x-ray together. Now, how would you approach this? Or, there might be a little bit more conversation, but it has gotten to the point with collaborating and working together that we kind of know what we would expect, and what we can anticipate from one another.
and yes, we are reimbursed per encounter in Minnesota. And I don't know what it's like for some of you. My experience, and I've banged my head up against the wall enough times trying to do it, to get hygienists to numb people sufficiently for extractions. I've only had 2 in my entire career that would do it. And I'm not trying it anymore. So I've learned, but the ADTs will do it. They will do the palatal injections, and they will make sure they're good and numb on the for the lower molars as well. So,
and I think that's something that we found too, is
that's
that
nothing against hygienists.
Yeah, well, and I think that's something that we found too, is that even our dual license providers that are doing ADT and hygiene, is that they are separate. Their needs as far as what they need are separate. So I think that that's something important to touch base on too. Here's another example of a day. Again, we have our designated walk-in provider, Dr. Adamczak, who's again seeing emergency walk-in patients. We have Dr. Quinlan working at the top of his scope, doing surgical extractions, doing some denture work. We have Dr. Daya, who did either an endo or crown consult here. And then we have our same thing with Dr. Ashkin, doing some limited exams and same-day treatment. And then we have our therapists really focusing on nitrous and children and getting the filling treatment completed.
And just so you know, we have just 2 nitrous rooms at this time.
Yep.
And there's one ADT that has it each day she's here, and then it rotates. The second room rotates among providers who are seeing children.
Yeah, that we do have a portable nitrous, but we found that with the closed door and working with children, that it is more patient-centered to just focus on having those 2 operatories running nitrous full-time. Here's another example of, again, our walk-in designated provider, Dr. Quinlan, again, being able to focus on comprehensive exams, doing extractions, working at the top of his scope. Our other dentist doing a root canal, and that linking, exams strategically. So all of these short kind of visits here are linked to our hygiene team, so that we've done some strategic scheduling here, that we're not going to link comprehensive exams, or we're not going to pull Dr. Ashkin out of that root canal appointment. And that's that kind of that team-centered, entire team schedule approach that we're able to, really focus on the fillings, and having that expectation of doing an exam and things that way. I might have one more example. So this is another example of the schedule where we have Dr. Quinlan. He's the walk-in urgent care provider, and that we had a lot of need today, that there were a lot of patients that needed support. Our doctors doing some, comp exams and working to the top of their scope, doing some denture adjustments and things here. But that also that there's opportunities. We typically, don't do this, but I think that's one of the things that as this team approach to care and as we collaborate, that we know we are going to have days like this where, hey, if you have a fail and you can help support a team member, that we've run into, Dr. Farley helping here. She was already designated in a nitrous room for that day. So, hey, it made sense for her to take this emergency child and was able to do same day treatment as she was already kind of set up in a nitrous room. So another good example as far as how we're collaborating.
Right. And then down here, no, I wasn't able to do a filling in 20 or 30 minutes there with these other two. You'll notice it says fillings here. This patient came in for a filling but was in a lot of pain and asked if she could have the tooth out, or he. So again, the ADT, Katie just numbed the patient up, and I got to use her assistant, and then just went into the room to take the tooth out while I was still able to do my two emergencies. To answer the question for the person looking for the hygiene schedules, these 20-minute slots are the linked exams for all the hygiene schedules. So I know as Janelle and I ran through this earlier, she didn't have the hygiene schedules up, but
just for it was more for ease of viewing. So all of these so this is a comprehensive exam that is linked to a hygienist in a separate column. So it would have been a really, really big schedule view if I would have included the columns that way. But you can see all of these small exams here, so that we have our doctors here doing, this is a comp exam, this is a comp exam, another comp exam, another comp exam, two other comp exams that are scheduled, our doctor here doing comp, and then we have our therapists here focusing on our periodic exams, x-ray, limited exam appointments as well. So just, as far as a little bit of an overview as how we would set limits on the schedule so that, we can only have one, as far as how many comp exams can we schedule per hour with hygiene. It's based on how many doctors we have available, just so that way the rest of the schedule is filled with periodic exams that dental therapists can do or doctors can do. Our visits for hygiene are 1 hour in length. So as we think about teamwork and the importance of the relationship between a dentist and a dental therapist, I really think there's a lot of different ways that you can introduce what this would look like. This is a picture of one of our dental therapists providing care on the left with her dental assistant. And I think as far as, knowing your team, knowing what's going to be best for them. I know Dr. Quinlan was, his approach, he was a mentor, and he was a lifelong learner and innovative, and really trusted us to, that we have this skill and this and this license to utilize it and to go to him with questions to collaborate. So we really try to use the word collaborate versus supervise. That we found that's been a better word to kind of summarize the relationship that we have. You can create structure in the form of case reviews or peer reviews and have that communication be real, to be formal, and to review specific treatment plans and x-rays and things that way. At Southside, we really like to do feedback and feedback loops. So we're constantly trying to provide positive and constructive feedback. So then that way we know where we're at and we're focused on learning, so that knowing we are all human and that we can collaborate together. So always encouraging team members to give feedback to one another. Check, kind of the check the box approach is, this was very new in my career, that I had a dentist that wanted to physically see my preps and final fillings. And it was, I want to see 3 amalgams, I want to see 3 composites, I want to see class 2, I want to see class 1. And it was what that dentist needed to be comfortable. And afterwards it was, whoa, wow, I don't need to see anything else from you again. But I think it's that understanding that, and again, how I approach it is it's just, hey, it's how we get there, right? Our outcome is that we want dental therapists to be successful and we want people to feel comfortable collaborating. How we get there can be any way that works. And as we've kind of mentioned earlier, is that collaborative management agreement that you have, we also have that in Minnesota, is a really good way to have those discussions and outline, are there going to be any limitations? Are there going to be some things that we have to work towards in our relationship, and have that be a guide to help facilitate how this teamwork is going to look like. So hopefully here are some different ideas as far as knowing your team, knowing what they need to be successful and to have dental therapy be successful. And I don't think there's any wrong way to necessarily go about it. But hopefully these are some different strategies that, when you hear them, you're like, oh yeah, I have this dentist that's going to want that, check the box. They're going to want to maybe see and be really involved, or you're going to have those other providers that are going to be more, I want to be a mentor, or I want to collaborate on these cases. Again, everyone's different, but whatever needs to happen for it to be successful.
And I'll just say a word on that when I was a part of a panel with the dental therapists presenting another time, the therapists themselves were talking about, well, yeah, check our preps or check our finals. And I'm sitting there thinking to myself, no, you have the same education as a dentist. Don't do that. But then I sat back and thought to myself, well, that's what you guys want to do, and if that's what'll help make it comfortable and get your acceptance, okay, go for it. Along those lines, like Janelle said, I was more the type that said, okay, I researched what your education was. I knew the director of the program, or he's still director at the University of Minnesota. So I got complete faith and confidence in him, and I knew they were trained right alongside the dentist. So my thought was, well, why am I going to check them any more than I would check a dentist? And for me, that strategy has worked out just fine. And nothing against our own profession here as dentists, but I've had more trouble with dentists than I have dental therapists. But I won't get into that. I'm not here to create a problem, just let you know, though, the therapists have been fine.
So again, just circling back on the how, and I think we have a few slides left, but we really have this patient-centered team approach to care, knowing that patients are going to receive a care team just as they would in a medical facility, different people doing different work that they focus on. And that this is just my call out as as leaders, is really to listen to the people that are doing the work to establish that how. And that again, we have dual licensed providers that have that hygiene and therapy background that is similar to what's going to the model in Wisconsin. And that is, we've listened to them as far as, our providers right now, they operate where they have an ADT day. And then when they want to do hygiene, that they have a hygiene day, and that they do feel that the skills that they're using and that the work they're doing is different. So that is how we move forward with, with navigating that and listening to the people that are doing the work. We found that having that top of the scope scheduling and treatment has really helped elevate everyone to do their best work, and working at the top of their scope has just been the best way to utilize team members. A few other working examples. I know we had the screenshots of those of the schedule, but yeah, that we've had exam opportunities that we're able to numb for the providers, just to have another person that's almost like an extension of yourself in a way that, I can look at an x-ray and I know what Dr. Quinlan can do. I know if this most likely is going to be a referrer procedure, or if this is something we can get back in with him, and that you establish that relationship and knowledge with all of your team members and vice versa, that they know, oh yeah, Janelle really likes those anterior aesthetic fillings, like, I'm going to make sure that you're with, with this team member, to move forward with that treatment. So it's great to establish relationships and having a strong team. And I feel like the dental therapists are able to do that. We know every practice model is going to be different. Every work environment is going to be different. So this is, again, just another, if you have mobile-based programs or school-based programs, or as your health center, working in some different environments, we have a lot of dental therapists working in other environments, in the state of Minnesota, and that I'd be happy to help connect you to those team members or to those dental therapists to help share knowledge. I think this may be our last slide before Q&A. We may have a summary slide, but patient messaging, wanted to touch base on this. Some things that have worked for us, and I can have Dr. Quinlan touch on this as well, is that when I'm explaining it, is that it's really, this is our focus, scope of practice. Like, I focus on this type of work, that I'm a provider that focuses on fillings, or I focus on the care of children, and that giving that kind of, I don't know, metaphor, but giving that kind of, hey, it's similar to a nurse practitioner. It's similar to a physician's assistant in the medical field, and patients, oh, okay, that's a good way for them to understand, like, oh, okay, yeah, like my primary care provider, the patient that, the health professional that I see is primarily a physician's assistant or a nurse practitioner. So I feel like that also, when you kind of set the stage that way, as far as that there's, multiple providers in the health system providing care, that they see that in the medical field, and they have that aha moment, that, and that confidence that way, as well as that warm handoff that, oh, you're going to see my friend Jenny, or you're going to see, a team member, and that really focuses on that work.
Right. And that's Jenny there, the left-handed
Yep.
dentist. So,
yeah, or dental therapist.
Dental therapist, excuse me. But the other thing that worked with that as well, early on, was just explaining, as Janelle was touching on, what it is a dental therapist will contribute to the team. And I would tell patients that this frees me up to do other things, but I will be back with you for certain other procedures.
Yep.
And for this office, we had it going really well. For reasons I won't get into now, we're not doing dentures anymore, but when we were, I would be in charge of the beginning of the treatment plan with the patient. And when it came time for restorative care, I would say, okay, I'd like you to see one of our dental therapists and get your fillings taken care of. And then after that, I will do the denture for you. And that all worked really well. I didn't get any pushback from the patients. Early on, I also had the therapist do a filling for me. The one Janelle did fell out right away. No, just kidding. It's still there, chewing just fine. The tooth is fine.
Oh, yeah, I did do a filling for you, Dr.
You did, yeah. God, that hurt. No, it didn't. No, just kidding. Seriously, everything went fine. Filling's still there. But I just started telling patients, okay, I've had a filling done by Janelle, and there was a different therapist there before Janelle, and I just said, oh, I've had a filling done by so-and-so. And I know when I said that, they'd look at me and go, oh, really? Okay. So that worked out fine that way. The other people who bought in really well were the assistants,
Mm-hmm.
and that was a good part of it as well, because they were the ones seeing the work right away, right off the top. And I had absolutely no problems with any assistants working with a dental therapist. Not one of them came to me complaining about the work a dental therapist was doing. So that was very refreshing and very helpful for the dental therapist as well. And the assistants also would tell the patients, oh, I've been working with, I'll just use Janelle. I've been working with Janelle for 3 months now. She's doing just fine. She does lots of fillings, and she was trained. She's doing them great. So that also helped patients. I imagine that may have happened with the hygienist as well, after the therapist started doing periodic exams or any limited exams with the hygienist.
So this is just a resource slide. So again, what I had mentioned earlier at the beginning of the presentation, just as far as some different toolkits that have been helpful for Minnesota use, as far as to hire and incorporating a dental therapist into your organization as well, or into your health center. Just some ruling about Minnesota that you can explore offline, and want to have the rest of the time for questions.
Thank you both so much. I'm just going to remove the spotlight here, and you can stop sharing your slides if you'd like, Janelle. That way, if folks want to come off camera or share questions, they'd be more than welcome. A few of the themes I heard while people are thinking about what questions they might have for you. Really helping everyone on the team get comfortable, not rushing, so that everyone's kind of got the level of understanding they need to figure out how to work together effectively. Really looking at optimizing scheduling. So not just like plunking in a dental therapist, but really thinking about what that looks like and how to most efficiently and effectively use that new team member. I am curious, as folks are thinking online, please feel free to either raise your hand by using the react button, and you'll see hand gestures there, or you can throw a question in the chat. So feel free to do either. This is the title of the profession is a little confusing. So I know you talked a little bit about messaging, but did you have like flyers or handouts, or like how did you get people to understand more about what this person is? Was that important?
I found early on that we didn't really need to go to that. It's a very good idea. 10 years too late for me, but yeah, I didn't find I needed that. They were very happy with a brief couple-minute discussion about it, and just rattling off some of their qualifications, and that I had the confidence behind them really helped the patients quite a bit.
Yeah, I think that the best, that kind of analogy of that a dental therapist is similar to a physician's assistant or nurse practitioner. I feel like that really helped people, understand, oh, okay, and that our scope of practice is of a little different from a dentist, or this is what we focus on, or these are, this is within our scope or what we kind of focus on, but haven't had surprisingly pushback throughout my career, a lot of curiosity. But I think that's where, patients are, the patients that we see in a health center setting, that they're usually willing to learn and welcoming.
When someone is employed by your health center who has dual roles, which it looks like many of your team members do, are they always on for their kind of top of scope role? Or are there some days that a hygienist, for whatever reason, is working as just a hygienist? Not that, no, there's no such thing as just a hygienist, but I mean, relative to those two different hats that someone might wear.
Yeah, we've hearing from our dual license provider that they like to have that separation. So, and I feel like it's also been helpful for our scheduling team that our dual license provider right now operates where she has 3 full days dental therapy and then 1 day hygiene. And that's a set day, and she wants to continue to keep her hygiene skill set up and utilize those skills. But that the work is different, that they found that, a dental hygienist is still an integral member of the dental team, and dental, that this is in an addition, that having a dental therapist and having the skill set is a different role, and that keeping that scope of service and care separate is coming directly from the dental therapist, that has been helpful for how they've operated, and that we've had to make sure that our scheduling team knows that, yeah, we're not doing a filling and then an exam and then a prophy and then an SRP and then a filling again, that they found that having that set day of working as a provider where you're doing fillings and doing exams and floating around, working multiple chairs, and then having a hygiene column that they've coming from them, that's what they've found is helpful.
Yeah, she prefers the efficiency of just having one day and focusing only on hygiene and keeping her mindset there. The other thing that I found is that in reverse, I was getting extractions in my schedule from her because she would do the hygiene periodic exam, she would do the fillings, and then she would say, you know, this tooth is just got to go now. And then I'd be the one doing the extractions. So whereas I used to do the exams, do the extractions, send them for fillings, and have them back for dentures, or send them for fillings and finish with extractions, whatever was going on. It then worked in reverse with her, and that was really nice.
Yeah, and I guess that is one thing that is different than a hygienist, is that we would, with that dual license provider, is that we do make every effort to schedule periodic exams with that. We aren't scheduling new patients now that Shelley is dual licensed. She's been here several years. She has her patient population that she sees on a normal recall basis, and that those are the patients that she sees, and she performs then the periodic exam with that hygiene treatment. So that's, I guess the one difference between a hygiene role and a dental therapist that's dual licensed is that they can do that exam.
So I'll keep going with the questions that I've heard from folks. But again, if you're on the webinar and have any kind of question for Janelle and Dr. Quinlan, please do either raise your hand or use the chat feature. Understanding you also have this collaboration agreement in Minnesota. What are the tips that you might offer to folks in Wisconsin, you know, dentists who are interested, but maybe a little, you know, nervous about what this looks like? How do you properly configure that collaborative management agreement? Do you evaluate them on a periodic basis? You know, what would you put in there to help you feel most comfortable if you had a newer dental therapist, for example?
That one as a dentist.
Yeah.
So in terms of the collaborative management agreement, myself and the very first therapist that I hired, actually I didn't hire you, but I would have anyway, but I was off on leave when she was hired. But anyway, the very first one, she helped draw that up because she knew the rules inside and out. And we looked through it together. You know, I trusted that she had, you know, the right laws in there. She wouldn't be benefiting anybody by sneaking in something, you know, that, you know, she legalized marijuana on her own or anything like that, you know. But the fact is that we went through it together, each step of it. So we knew what it was she was capable of doing legally. And I was able to ask questions then. Okay, is there something we've left off? Is there something that you're capable of doing but you don't want to do? Or at that point, if there, you know, one of the dentists out there is not comfortable with something, you can either decide to leave it off, or that's when you can agree to do what Janelle mentioned. Okay, well, you know, let me just check this step of that procedure, let me check that step, and let me work with you on that. I want to know how things are going for you. It was also mentioned by other dental therapists, we'll just keep something off. And maybe there's some way that the dental therapist, even though they're not performing it, can be mentored into doing it with the dentist at the dentist comfort level, to become a part of the team and be doing something for the dentist within the scope of their practice. That's the things that I feel a dentist could do to keep themselves comfortable with it and to stay on top of the situation with the dental therapist. I had also been director, and I just found that if a director is keeping the pulse of the practice, you just kind of know what's going on with everybody and all their procedures and their patients, thereby checking through charts, looking through the schedule on a daily basis, seeing how treatment goes, if there's any problems with any patients. The director is always called in. And that way you can also find out what how a therapist is doing as well, or just doing one-on-ones, checking in at 3 months, 6 months, and saying, how are things going? Okay, at 3 months, let's review the things I said you couldn't do, and let's do them now, or let's check on it. So that's one way I would look at it as a dentist in bringing on somebody new and in a new profession like this.
Yeah, there's a template that also is helpful, and I can share that, the Minnesota template. I'm guessing it will be similar as far as the practice guidelines to Wisconsin. But that I haven't operated under any limitations to the scope of practice, but that we have had conversations as far as what they need to collaborate, as far as those different things, like, I just need to see XYZ, not necessarily setting limits, but what do you need to be comfortable? But I do think it also kind of, as far as how your practice operates. For example, the Mission of Mercy in Minnesota, we have dental therapists that practice at that event, and that they have collaborative management agreements with dentists. And we do set a limitation for them that, because at the event, we do not do direct pulp caps. So we write in there, you can't do this, but at the event, we don't do that. So it's not necessarily, as far as what your practice and your philosophy to care for your practice, I feel like that's important to make sure that you're calibrating with your dentist and understanding the why and the, as far as philosophy to care and approach to treatment and care, maybe not, or if limits are, again, the how is optional as far as how we can make people, make team members comfortable, by setting limits and by working up to that, or by not setting limits and having different systems in place to get people comfortable.
Thank you. I have a question from Pete in the chat, who is asking, what are some extra ways that you optimize your schedule and missed appointments? Are you doing walk-in appointments and strategic overbooking?
So we are not doing any overbooking of the schedule, but we are doing that entire team strategic scheduling, kind of looking at the schedule as a whole. We also have a designated walk-in urgent care provider daily, where we have, I think on Mondays and Fridays, we have five or six limited exams of patients that are in, are either experiencing pain or have, a concern, and that we found that our need for, that to meet patients where they're at, of having walk-in services of patients that are in pain, that walk-in provider that has been a dentist is able to then do that limited exam and do that same day treatment, and kind of work out of two chairs and meet patients in that way. We do strategically open schedules about 6 to 8 weeks out. So we are not opening schedules out far. And we found that has been the greatest success in our no-show rate, is that that there's that high demand for patient appointments, and that patients know that when those appointment slots are available, they want them and then they keep them. And that we found that it's really creating an opportunity for us then to optimize and make sure that we have our full capacity, so that when we open the schedule, these are the availabilities, these are the openings, and that we found that has been really, really successful. We've tried 3 months, we've tried 6 months, we've tried everything, but we found that 6 to 8 week has been the sweet spot to have a very low operating no-show rate at about 10%.
And also the text reminders.
Yep, that our system does do like text reminders, that has been helpful as well.
That made a big difference too.
Okay, I know a few health centers who are interested in hiring dental therapists in the near future are just interested in how to set salaries, pay scale ranges. How does that work at Southside, relative to a hygienist or relative to a dentist for a dental therapist?
Yeah, so typically, there's as far as the tiers that we have the dental hygienist, then we have the dental therapist, and then we have the advanced dental therapist that they can work under general supervision. The dentist does not have to be in the clinic when they're operating. So we have that kind of 3-tier mark. There's financial information that is available kind of as like an average for what typically is like the going, we've been fortunate that we haven't had to hire a dental therapist in quite some time, that we've had dental therapists working for a while here. But as far as the range, I know we've just changed our dental hygiene salaries just because the need for hygienists have been extremely competitive, that we're looking more at like a higher end of like 42 to 48, depending on experience for a hygienist. And just that because we found that there's just such a shortage right now, and that has been helpful with retention of our dental hygienists. And then therapists between the range of 50 to, I would say, 55, and then advanced dental therapists 55 plus based on their experience, I would say is kind of average, based on their skill set, probably a little bit more as far as what they're able to do.
Thank you. And I'll just wrap us up with one last question here. So Teresa asks, is the collaborative agreement written up between the dental therapist and the clinic, or is it written up between the dental therapist and the specific provider? How does that work for a multiple provider clinic? So I'll just note at the baseline, that collaborative management agreement must be entered in between the dentist and the dental therapist. So that is a requirement. The dental therapist can work for multiple clinics. The dentist can have up to 4 collaborating dental therapists in Wisconsin. But I'm sure there is, employment contracts and agreements with the clinic. Otherwise, when, they become employed in the health center setting. Anything else on that question in particular?
Yeah, I think, because we have so many dental therapists and we have a lot of dentists, that as far as what we do have a standard agreement for the for the organization. And then again, it's that how that changes. So why we're having dental therapists to improve XYZ outcomes. That's what we're going to be doing, but how we get there, and this is our collaborative management agreement, but how we get there, how can we make sure that we create systems so that people feel comfortable? Is it that checklist? Is it that let's case review? Is it treatment plan reviews? How can we make sure that every dentist who's going to have different experiences and different different backgrounds, how can we make sure that everyone on the team is comfortable?
All right, and the last follow-up on that, for the case of the clinic, is it possible for the dental therapist to have a collaborative management agreement with more than one dentist? And my understanding is yes. Is that right? Yeah, cool. Well, we are right at 2:30 here, so thank you so much for sharing your insights and your candor with us. You guys really are the pros in Minnesota. We've been doing this for quite a while, and we have so much to learn from you. But I know there's a lot of excitement in Wisconsin. A lot of people really, as you say, kind of dental therapists curious about what this looks like. And just really want to appreciate your time, Dr. Quillen and Janelle. Thank you both. I'm sure we'll stay in contact, and for health centers on the call, there will be more to come, as we await the final kind of go switch. More communication, more resources, more tools will be available, but, start having these conversations, start talking with staff and, understanding what this might look like and where the opportunities are. It's a really exciting time to really look at improving both oral health access and outcomes for the patients served at health centers in Wisconsin, which is what this is all about. So, Janelle or Dr. Quillen, any last information before we log off?
No, thank you. You have the slides. I can send. I don't think there's any changes or updates, but I can send it again. And that
I've got them now. I'm going to send them out to the group. So
are you sending us each a fish fry and a 6-pack of beer?
Oh, your own one for sure. My goodness, especially for twinning, the whole thing, a lot of love. But next time I come to the cities, clinic is going to have
a lot of love for
stop
Wisconsin still.
tour.
So we're glad to help.
Thank you.
Yep.
Yes, thank you.
All right, happy National Health Center Week, all.
Yeah.
Good afternoon.
Thank you.
Bye-bye.